Diabetes has been recognised for millennia as a devastating and deadly disease. In the 1800s, a 10-year-old child with diabetes had on average 1 year to live from the time of his or her diagnosis. In early reports of patients with diabetes, one doctor stated the following about his newly diagnosed patient.
He was affected about 12 months ago with pain in the body, followed by weakness and inability to pursue his ordinary avocations. He passes from 12 to 15 pints of urine in the 24 hours, which he states tastes as sweet as honey. Appetite morbidly great, constant thirst.
Those who did survive longer term suffered from symptoms that reduced their quality of life. Another doctor remarked about his patient who had been suffering from diabetes for some time.
Disease of some years' duration had produced a haggard aspect and depressed spirits. He drank about 10 pints of fluid daily and passed 9 pints of urine, smelling like hay and sweet to the taste.
Doctors came to suspect that diabetes was caused by dysfunction in the normal breakdown and use of food for energy. They observed that patients with diabetes who consumed a normal diet had abnormally high levels of glucose in their bodies, compared to healthy individuals. So their doctors experimented with strictly limiting the intake of carbohydrates to control blood glucose levels. These starvation diets, which involved consuming less than 450 calories per day, became a widespread and somewhat effective approach to diabetes treatment. However, under this strict regimen, if the patient did not die from diabetes, she most likely died from starvation. Dr. Elliot Proctor Joslin, a prominent American physician specializing in diabetes who employed this diet in the early 1900s, wrote,
"The aspect of these children was truly dreadful. We literally starved child and adult with the faint hope that something new in treatment would appear."
Scientists investigating the involvement of different organ systems in diabetes knew that the removal of the pancreas in dogs led to all signs of diabetes, including emaciation, weakness, excessive thirst, frequent urination, and increased glucose levels in the urine. They hypothesized that diabetes was due to a lack of a protein hormone produced in the pancreas. This hormone, now known as insulin, provides a signal to cells in the body to utilize glucose for energy by taking it up and breaking it down. So when insulin is not produced, many of the cells in the body of a patient with diabetes cannot utilize glucose for energy. Consequently, this excess glucose remains in the body, leading to elevated glucose levels in the blood and urine. This excessive amount of glucose causes more water to be retained in the urine, leading to excessive urination. Given the importance of the pancreas in diabetes, doctors tried to feed their patients pancreatic tissue and extracts, but these interventions had no effect on the disease. Then, in 1922, scientists in Canada purified insulin from the pancreases of cattle. They injected it into a young boy with diabetes who was on the verge of death. Remarkably, after a few injections, his blood glucose levels returned to normal and his health improved. The bovine insulin was similar enough to human insulin to take its place and restore normal glucose metabolism. From then on, more and more patients with diabetes were treated with regular insulin injections, with incredible results. A single drug had transformed diabetes from a fatal diagnosis into a treatable chronic disease. Soon thereafter, drug companies developed methods to produce insulin on a massive scale, and bovine insulin became the standard of care for diabetes. Insulin was a true miracle drug for diabetes. However, a lifetime of insulin treatment introduced new challenges and complications. Injection needles had to be sterilised 3 times a day and manually sharpened. The subcutaneous injections could be painful and sometimes cause side effects such as disfiguring hollows at the injection sites due to lipoatrophy. Consequently, scientists and clinicians almost immediately began investigating alternative insulin delivery methods. Although the prior attempts to treat patients with diabetes by feeding them insulin-rich pancreatic tissue yielded no positive outcome, there was still great interest in developing a form of insulin therapy that could be given by mouth. Doctors tested oral administration of various doses and formulations of insulin to no avail. All the research studies at the time reached the same conclusion, that orally administered insulin was ineffective. So how can the effectiveness of a drug regimen depend on the route of administration used? In this lesson, we will look at the story of insulin in more detail, and we will compare and contrast various routes of administration to see why administration via one route may have a life-saving therapeutic effect, while another route may be ineffective.